Here we go on Special Senses, Part 1, page 545, beginning with the vision special sense. As you can see here, here's a typical view of the eye, and we have some ideas here about what you need to know. So the lacrimal caruncle is right here. That's a little secretory device. We have the medial commissure, which means the coming together of the lids, which they're also known as palpebrae. We have the pupil, the iris, the limbus around the edge of the iris, the sclera. The opening of the eye is referred to as the palpebral fissure, lateral canthus coming together. Okay, so moving right along, we then consider this artistic rendition of the eye coming from the side view. We can see right straight through the cornea and to the underlying tissues and structures beneath. There is a little opening right here, the anterior chamber, which is in front of the pupil and the iris. Notice that we have a covering over everything here, a covering over the cornea and the sclera. This covering is referred to right here as the bulbar conjunctiva. On the inside of the lid, we have the conjunctival sac housed on the inside here. Why are we not getting? Oh, here it is over here. The palpebral conjunctiva. So the palpebral conjunctiva, which creates a little fornix or a fold right here, and this is the bulbar conjunctiva. In between is the sac. The things that are flowing through there are tears. Okay, so we can clean the surface of the eye, blinking, secretion of tears, and so on. Okay, the upper lid can be moved. The lower lid cannot. We can close the eye, of course, with the orbicularis oculi, facial nerve, cranial nerve number 7. And we also have a little tarsal plate right here, that is the sort of handle through which we lift the eyelid. The levator palpebrae superioris is the muscle right there that opens the eye. Orbicularis oculi closes the eye. Okay, we see over here the formation of tears through the lacrimal gland. The lacrimal gland, innervated by cranial nerve 7, facial nerve, has little openings through the canaliculi right here, or ducts, and so we then have secretion into the conjunctival sac. We're coming medially this way. We're going to be entering into the puncta. Here there's a punctum, an inferior and a superior punctum. Okay, lacrimal punctum. There's going to be little canaliculi here carrying the tears out onto the nasolacrimal duct, which then ends right here at the inferior meatus. If we get a little bit of extra emotion, or we're cutting onions or something pungent, we may get extra tears, and we have to blow our nose. Okay, then we're going to be having the muscles, extra ocular muscles of the eye. The straight muscles are referenced with the word rectus, straight. So we have a superior, a lateral, an inferior, and ultimately on the other side a medial rectus. Okay, here we see the medial rectus depicted from above. Also from above we see the superior rectus, the lateral rectus, and then notice right here we have something that's referenced as the superior oblique muscle. We see it over here coming up. It's going through a little pulley on the medial wall of the orbit and then coming this way. Notice it goes under the superior rectus and grabs right over here. You would imagine if this muscle was contracted and shortened that it would pull the eye this way. And it does to some extent, but oddly, it actually spins the eye, and it makes the eye look down and out. Right, so the eye is actually going to spin slightly and then look down and out this way. So a right eye will look down and to the right. Okay, here's the inferior oblique, and a similar thing happens. It's going to pull the eye. The eye is going to, as a result, spin and look up and out. So the right eye will look upward and to the right lateral aspect. So diagonally 45 degrees up and to the right. Okay, so here we have the muscles listed. Here we have the actions of the muscles right here. Here we have the nerves. Okay, and so you can see here that the lateral rectus moves things laterally. The medial rectus moves things medially. The superior rectus moves the eye in a superior direction looking up. The inferior rectus makes the eye look down. The inferior oblique, oddly enough, makes the eye elevate, so it looks up and outward to the lateral aspect. Right lateral if it's a right eye, left lateral if it's a left eye. And then the superior oblique makes the eye look downward and toward the lateral. So down and out to the right if it's a right eye, down and out to the left if it's a left eye. Okay, then notice all of these nerves are innervated, or muscles rather, are innervated by cranial nerve 3 oculomotor, except for the lateral rectus. We have just one nerve, and it's dedicated to the lateral rectus, and it moves the eye to the lateral aspect. It abducts the eye. So this is the abducens nerve. It's cranial nerve 6. Okay, so looking to the right lateral with the right eye or the left lateral with the left eye, we use that nerve. Then down and out to the right, we use the trochlear nerve to act upon the superior oblique. So down and out to the right with the trochlear nerve with the right eye, down and out to the left with the left eye is trochlear nerve. And this is number 4. Number 4 and number 6 are the exceptions. We go around the eye and notice that if we look with both eyes straight up, it's right 3, left 3. If we look up and to the left slightly diagonally, it's right 3, left 3, because left is using the the inferior oblique. And then straight to the left, we're going to use right 3, left 6. 6 because left is using abducens. Down and out to the left, right 3, left 4 because it's using superior oblique. Straight down, right 3, left 3. Down and out to the right is going to be right 4 because of the superior oblique, left 3. And then straight to the right is going to be right 6 and left 3 because the right is using the abducens to use the lateral rectus. And then up and to the right diagonally is right 3, left 3. So that's going around and testing the cranial nerves just the way you like it. Over here we have 3 tunics of the eye. We have the fibrous tunic, which is made up of the cornea and the sclera. We have the vascular tunic, which is made up of all of this material here, including the iris and the ciliary body and the choroid layer here, which contains pigment and vasculature. And then we have the number 3 neural layer, which is the optic nerve's contribution here to the retina. It ends right here in the corona serrata. Okay, that's the edge of your retina, anterior edge. And then we have over here the ability to contract the pupil with the sphincter papillae, and this is exclusively a parasympathetic activity, cranial nerve 3. And then we have over here the ability to dilate. Okay, we use the outer muscle here for dilation. Notice the outer muscle here is going to be having fascicles running that way, dilator papillae. The inner circular is called sphincter papillae. Inner sphincter is going to be parasympathetic, outer is going to be sympathetic.